Hello, everyone, and thank you for joining our webinar today, the Community Eligibility Provision, a strategy to improve public health, not just a school meal funding option. My name is Emily Pia, and I'm on No Kid Hungry's Center for Best Practices. I will be managing the back end of the webinar today. So if you're having any audio issues or technical difficulties, please go ahead and send a message to me in the chat box or the question box, and I'll be able to help you. I want to mention that we are recording today's webinar, so I will be able to follow up after today's webinar with a recording and a copy of the slide deck. You will also find a copy of the slide deck and the research paper that we're talking about today in the handout section of the control panel on the right-hand side of your screen. And we will be taking questions today, so feel free throughout the webinar to send your questions in the question box, but we'll go ahead and get to those at the end of the webinar. And we can follow up with any questions that we don't get to in today's 30-minute webinar afterwards as well. Without further ado, we have a short 30-minute webinar scheduled for you today. I would love to introduce my colleagues on the line who are going to be presenting. We have Tamlin Kelly, who is a senior manager in No Kid Hungry, Maryland. And she worked on this study with Dr. Susan Gross, who was actually the PI on the study, and she is an associate scientist at Johns Hopkins Bloomberg School of Public Health. So without further ado, I'm excited to hand the webinar over to Tam. We've got some really exciting research to share with you today.
Hi, thank you, Emily. So again, this is Tamlin Kelly with No Kid Hungry, Maryland, and I want to thank Emily and also to everyone who has called in today to hear more about CEP and our new study, which has just been published in the Journal of Hunger and Environmental Nutrition. And as Emily mentioned, the web link and the article is in the handout section. The bottom of this slide also has the web link itself. So during the webinar today, Dr. Gross and I will review CEP. We'll give an overview of the methods we used in our study, and then we will present the findings. Following that, we'll take a few minutes to suggest some strategies to advocate for CEP in your community. And we will be available for questions or comments following the presentation. So just to make sure that we're all on the same page, we're here today to talk about the Community Eligibility Provision, or CEP. If you were hoping to learn more about the Center for Effective Philanthropy, I'm sorry to disappoint. Jokes aside, CEP is a federal school meal funding option that allows schools to provide free breakfast and lunch to all students. That's why advocates often refer to CEP as the program that creates hunger-free schools. CEP removes barriers to participation in school meals, including stigma and, of course, the costs for students and families. CEP also streamlines meal service and reduces administrative costs for schools. We often hear in the news about school lunch shaming when a student is stigmatized in the cafeteria for owing money. Another great thing about CEP is that it eliminates school meal debt and therefore eliminates school lunch shaming as well. The Food Research and Action Center reports that about 64% of eligible schools are currently participating in CEP nationwide, and that over 13 million students attend a hunger-free school. CEP became available to all schools in the 14-15 school year, and Baltimore City Public Schools enrolled in CEP at the end of that school year. Since Baltimore City Schools opted into CEP in June of 2015, they are serving an additional 10,000 school lunches every day. That's a 21% increase. Because of that increase in meals served, federal school meal reimbursements increased by an additional $9.6 million per year. This has allowed the school district to hire more food nutrition staff and to upgrade many part-time positions into full-time positions with benefits. School staff also benefit from less time spent on administrative tasks. Before CEP, the staff in Baltimore City Schools collected more than 85,000 meal benefit forms every year. The district had to hire temporary staff to process the forms, and it cost over $200,000 a year just to do that. While these statistics are quite remarkable, we wanted to know more about the impact of CEP beyond school meal operations. So, we devised a study to address the broader impacts of CEP. We already knew that CEP was associated with higher school meal participation and improved school meal operations. but we wanted to know if there was any change in suspensions, academic achievement, school advancement, graduation rates, or food security rates.
Okay. Okay, so in order to answer these research questions, we use a logic model as a roadmap for how CEP may impact students and family. So in this chart, we saw that providing free meals to all students and promoting this to their parents would lead to increased participation of school breakfasts and school lunch and increased knowledge of CEP. What we hoped was by providing the meals and an increase in participation, it would lead to increased attendance, decreased suspensions, increased break promotion, and decrease of family, but a decrease in household food insecurity, or better food security for all the families, as well as better health and well-being for our students. So we had 3 strategies to answer these questions. The first strategy was to use public use data from the school, the Maryland School Department of Education. The second part was to do focus groups with high school students, parents, and administrators in schools that had adopted CEP. And finally, to do a household food security survey with schools that participated in CEP, as well as schools or families in schools that were eligible for CEP but decided not to participate. I would like to focus on the third part of this study, which was the household food security survey. We used the household food security survey from USDA. It's a 6-item food security tool that asks questions about availability and accessibility and how meals were experienced in the last 6 months. And some of the questions are listed on this slide, including not knowing where money came from, who could afford balanced meals, and having to cut size of meals, and finally the last was hunger because they didn't have enough money for food. We conducted the survey in 5 schools in Baltimore City, public schools which had adopted CEP, and 3 matched schools in another Maryland school district. Flyers were sent home with links to an online survey, and consent was received at the time the survey was taken. And we also went to schools to collect the surveys using tablet computers for those families who did not have access to the internet. We collected 427 surveys between the spring and fall of 2017. Overall, and that's broken down to 151 comparison school households and 276 Baltimore City school households. So let's move on to the results. First, we'll share the findings of the public use data. The public use data was for the years before and after the institution of CEP in the Baltimore City schools, so that we could see if there is a change in the school markers of attendance, meal participation, as well as suspensions. So we found a significant change in school lunch participation before and after CEP in Baltimore City schools, which is shown on the left in the graph on the left, where you see a rise. We did not see any change in the comparison district.
In terms of the public use data, we also found improved chronic absenteeism rates and improved grade 10 promotion rates.
The second part of our study involved focus groups and administrative interviews. This was really important because we wanted to get the voices of those people who were experiencing CEP. And in fact, we limited our group to those who had answered our food insecurity survey for the parents and the high school students, but also for those who had been enrolled in the schools before and after the CEP was instituted, so we could get an idea, a perspective. We found a general positive perception of CEP. Participants reported fewer financial barriers to accessing school meals, as well as less stigma surrounding school meals. Here are some examples of we heard from high school students. They said that some school students don't have food all the time at home. And one student said, I had to ask other people for lunch like I was homeless or something. It's wrong. I didn't feel comfortable asking other people for that lunch. And that refers to the time before CEP was adopted in the school. And here are some examples that we heard from the parent focus groups. Some participants in these groups were Spanish speakers and an interpreter was used.
Sure. So for example, we heard, I think it's great that there is this program. I know for a fact that a lot of families, the only meal they have is here at school. Another parent said, maybe at the time when you apply for free or reduced price school meals, you don't need it, but things can change throughout the year. Sometimes there's more work than other times. It can get messy and is a problem. The kids should always be able to have food at the table.
Finally, we conducted in-depth interviews with administrators in CEP schools to better understand the impact on the administration of schools.
So some of the things we heard from them, we have a lot of families that have food access issues, so we know that we have kids that are hungry. The 2 meals that they get here a day might be the most well-balanced and full meals that they get. We also heard administrators say they like the fact that kids have access to food because there are children in the lunch shift that eat like they have not eaten maybe since the day before. Another said everyone is able to eat now, and that feels good to know that if kids don't eat, it's because they didn't want to, not because they don't have lunch money. And then we also heard another administrator who told us that before using CEP, they had a problem with kids stealing lunches. So
now for the results of our food insecurity survey.
So this pie chart shows that the rate of food insecurity overall among all of the 427 households we surveyed was much higher than expected. As you can see, 56% of families surveyed were food secure, and 44% of families surveyed were food insecure. This is significantly higher than the national rate of food insecurity. And on average, about 14% of all US households with children are food insecure. We were also very disturbed by the fact that 20% of families reported the most severe form of food insecurity, called very low food insecurity, which means that family members were going hungry because there wasn't enough money for food. Nationwide, about 4% of all US households experienced very low food insecurity in 2018, but you can see here that 1 in 5 families in our study had disrupted eating patterns or reduced food intake in the past year. We further examined the food insecurity data by school and found that for families with students in Baltimore City CEP schools, about 1/3 have limited or uncertain access to enough healthy food, and about 2/3 are food secure. When we compared these rates to the comparison district school, which again were CEP eligible but not participating, we found much higher rates of food insecurity. In these schools, a shocking 60% of families reported food insecurity.
We also wanted to make sure that the results we were seeing was not because of other factors, such as race and ethnicity disparities between schools, parental education, timing of the data collection, the student's age, or even the language of the survey. So we did this using logistic regression to look at the odds of food insecurity. The unadjusted rate, which is model 1, it was about 3 times the eligible school households were 3 times as likely to be food insecure as the participating school families. And even after adjusting for all these other factors, it was still close to 3 times as likely. It was at 2.85 times. So to summarize, in plain English, our study found that households with students attending Baltimore City schools who had adapted CEP were nearly 3 times less likely to be food insecure as compared to households with students attending comparison school district eligible schools but not participating, even after adjusting for all other confounding factors. I do have to acknowledge some limitations of this study. When we were given permission to do this study by the school districts, one requirement was that after the school district gave us permission, we must get permission of each principal at each school we would survey. This limited the number of schools that we received permission from. It may have been that there was some bias on the principals who approved, that they were more interested in food insecurity in their schools than other principals, and also that they may have had the most needy of schools. However, we did note that we collected most of our data at school activities at all the 5 schools, and each time we had a meal being served, and it was equal among the schools. So it's probably an equal amount between CEP eligible and CEP participating families, that they were probably similar across that. For the other data, for the school level data, we did have a problem with data did change a little because of an uprising in 2015, which was the start date of the CEP adaptation. Also, there were state level changes in graduation requirements, and the way the data was collected for school attendance was capped at 95%, which made it hard to look at improvements in attendance. So that's all we have for slide, but we do have to acknowledge that this was a huge team effort. We want to acknowledge that the Center for a Livable Future at Johns Hopkins University provided us with the funding for this study, that we had a team at the School of Public Health, a team at the Maryland Hunger Solutions, and we also had a team at the Center for a Livable Future who were involved with every step of this research.
Thank you, Susan. So we're going to move on now to the last section of the webinar, which will review some CEP advocacy strategies. So the Food Research and Action Center reports that more than 1/3 of CEP eligible schools are not participating in CEP. We can advocate for more CEP eligible schools to participate by acknowledging that yes, CEP is a school meal funding option, but it is more than just that. We encourage the reframing of CEP as a school meal funding option and an effective strategy to improve education outcomes and public health. So how can we do that? CEP can be included as a strategy to improve education and public health outcomes, but we may need to inform school administrators and public health professionals. Most are not aware of the option to elect CEP or the impact it could have. You may want to reach out to superintendents, principals, school boards, education advocacy organizations, or parent associations, and let them know that electing CEP may improve education outcomes and reduce rates of absenteeism. You can also let them know that electing CEP may improve health outcomes and reduce rates of food insecurity. When talking about food insecurity, you can use the formal definition, which is that food insecurity occurs when a household has limited or uncertain access to enough healthy food. And you can also talk about how people in food insecure households may skip meals, eat less food than they need, or go hungry because there isn't enough money for food. The reason our study focused on measuring food insecurity is that it has been shown to have significant negative impacts on children and families. For example, children living in a food insecure household are more likely to have poor health. In addition, they are more likely to repeat a grade or be suspended from school, and to be absent from school or to have poor academic performance. Children in food insecure households are also more likely to be irritable, to show aggression, or to be easily distracted. You may want to advocate for CEP by talking about the gap between students who qualify for free or reduced price school meals and those who need it but do not qualify. Many people assume that all low-income students who need assistance qualify for it. The fact is, many low-income students can't participate in the school meal programs because their household income is too high to qualify, yet too low to afford the reduced price school meal co-pays or the full cost meal fee. You may also want to use a chart like this one that illustrates this wide gap between income levels that qualify for meal assistance and the minimum income needed to survive in your community. So this chart shows that a single parent with one child, or a family size of 2, that earns more than $30,500 a year is not eligible for free school meals. Yet the minimum income needed for this family to meet their basic needs in Maryland is nearly twice that amount. So it's close to $60,000 a year. You can find the living wage for families in your community at the website on the screen. It's livingwage.mit.edu. The first resource listed here is to the Food Research and Action Center's website, which lists CEP eligible schools by state. A few other helpful resources are included here. And I'll also mention the Hunger Free Schools banner that there was an image of it at the beginning of the webinar that we have used successfully in Maryland to help spread the word about how CEP creates hunger-free schools. Before we open up the line for questions, Emily Pia has a quick announcement.
Thanks so much, Tam. And some of the questions that are coming in right now actually will be answered in tomorrow's webinar. So I just wanted to announce, and again, the slides where you can actually click this link are available in the handout section. But tomorrow we're having another 30-minute webinar titled Strategies for Finding Success with the Community Eligibility Provision, which I'll be joined with a school nutrition director who's been operating CEP for as long as it's been available in Georgia, and she and I are going to share a lot of strategies that we hear from CEP schools who are small rural districts all the way to large urban districts, and what works for them to make sure that they're increasing participation and maximizing reimbursement and making sure that CEP works for their school. So register for tomorrow's webinar, same time. And I think that's all I have. If we're ready to open questions, I can start reading those.
Okay, great. I see in the questions that there's a question about whether or not there's a sweet spot for the percentage of free eligibility that can make this program financially viable for small rural districts without the large volume of students. I think that that's an interesting question, and it really varies quite a lot. We have 2 schools here in Maryland that are using community eligibility, and they're just at that 40% cutoff. So they're just the minimum eligibility to qualify, and they're able to do it without losing money. And then we have other schools where they feel like they need a much higher identified student percentage in order to make it financially viable. So I think it varies quite a bit, and there's factors such as staffing, meal costs, that all come into play to be able to answer that question. So it's kind of a non-answer to that question, sorry.
The first question, there was a question about when was the data collected for household food security? Although ideally we wanted to do it before and after CEP initiation in Baltimore City due to need for approvals, we only were able to collect data after CEP was established in the Baltimore City schools.
We had some questions about whether or not CEP is available only to public schools or any school, regardless of whether they are public or private. In order to use CEP, you have to participate in the National School Lunch Program. So there are private schools that do participate in the National School Lunch Program and therefore can use CEP as well. For all of the schools that are eligible are on that website that I mentioned earlier on the slide 2 slides ago. So you can find private schools as well. And then we also had a question about how is CEP different than sort of the regular school lunch programs. And in addition to some of the things that we talked about how CEP reduces the need for administrative costs, the main difference is how schools are reimbursed for their school meals. So in CEP schools, they're reimbursed based on the percentage of students in that school or that group of schools that qualify based on a program or based on a system called direct certification. And I believe, Emily, did you say that you wanted to answer some of that as well? No, okay. And in schools that aren't using CEP, the way that the programs are reimbursed is based on whether or not the student who eats each meal qualifies for free, reduced, or paid meals. So it's a different reimbursement structure. In some cases, it's more advantageous for schools to do it one way or the other, but it is a pretty significant shift in how schools receive their reimbursement for school meals. And so that can sometimes be a barrier to getting the program off the ground. Is just the big change that it represents. We also had a question about direct certification systems. So as I was mentioning, in community eligibility schools, they're reimbursed based on the identified student percentage, which is a number that is obtained through the direct certification system. And there are best practices in terms of direct certification systems, certainly in different ways that it's being done across the country. And currently in Maryland, we've just moved to a centralized direct certification system, which means that the state itself does the direct certification matches. So they take the list of students in each school, their names, and compares them to the lists of students that are receiving Supplemental Nutrition Assistance Program benefits, or SNAP, as well as a few other programs as well, such as TANF, students who are been identified as homeless or migrants. And it compares those lists to each other. And so that's now being done at the state level. In other places, in other states, they do this at each school district level. But there certainly are best practices. I think one of the questions referred to checking for extended family for students living in households with other students that may be participating. So those are best practices, again, of what can be done to make sure that we're counting every possible student that qualifies.
In terms of our findings?
I think so. So we have a question about, can you elaborate on the findings to improve students' health?
So one of the things that we had hoped to get was information about referrals, absentee related to health and referrals to a nurse. And unfortunately, those were not data available to us, so we could not, for this study, elaborate on student health per se. But I do know that from other research I have done that food insecurity itself does lead to health, especially due to mental and emotional crises. Anxiety is very high in children with food insecurity, in households with food insecurity. Lack of resistance to illness, they're more likely to catch infections if they are food insecure, and also delays in development and cognitive delays in development have been associated with food insecurity. as well as delayed growth.
Right, and as we mentioned earlier, there's been a lot of research that shows the negative health impacts of food insecurity, and looking more into the depth of those, I think we can maybe put a handout with the webinar slides that goes into some of that in more detail. But we know that kids in food insecure households, they're more likely to be hospitalized, they're more likely to have upper respiratory infections. There's really a long list. And I think perhaps it would be helpful if we sent that out with the slides.
We can do that. Thank you all so much for joining. It is 2:30, so we are ready to wrap up the webinar. Thank you so much to Tan and Dr. Gross. This was an excellent presentation. Really appreciate you being on the phone today. I'll let you say any last few words.
Thank you all again, and Dr. Gross and I are willing, our contact information is up on the screen now. We're more than willing to help advocate for CEP or to explain the study to anyone who has questions or to help you in your state. So please don't hesitate to reach out to us.
Okay. Thank you, everyone. Have a great day.